I'm actually really excited today. I'm here with Casey Ballard, and she is here to talk with you a little bit about her career as a nurse anesthetist. So, Casey, if you just want to kind of jump in and maybe introduce yourself and maybe give a little bit of background about what you do.
Yeah, absolutely. Thank you for having me. So like Chelsea said, I'm Casey Ballard. I am a nurse anesthetist at Grant Medical Center. I'm also the assistant program director for the Otterbein Grant Nurse Anesthesia Program. So that's my primary role, but I still do have clinical obligations and I still work in the operating room. So it's great to be able to join you guys today and to answer a lot of the questions.
Yeah, absolutely. And so can you talk about in your role as a nurse anesthetist, as I try to pronounce that correctly, can you, can you talk about what your daily work looks like when you are working, in that clinical setting?
Yes, absolutely. So a lot of times it's easier to just say CRNA instead of nurse anesthetist. Nurse anesthetist. It is definitely a tongue tie for a lot of people. But when we go to the operating room, a daily schedule for us, it really can vary. Some days, I can speak to the facility that I work in. We are a level 1 trauma center, but there's also an outpatient surgery center that is connected to the facility. So you might be assigned over at the outpatient area, or you could be assigned over in the main hospital where the cases are going to be higher volume, higher acuity, and could potentially go to the ICU. But you show up quite early in the morning, probably 6 o'clock in the morning. Sometimes we have cases that start as early as 6:45, but usually around 7:30 is when our cases start. So you're responsible for going into your operating room. You have to do a complete checkout of your anesthesia machine to make sure that it's functioning properly, make sure all of your other equipment is functioning properly. You need to get your medications drawn up for that individual patient that you're taking care of. And you also need to look that patient up in the electronic medical record prior to going to the patient's pre-op room and interviewing that patient then and talking through their medical history with them, discussing whether they've had anything to eat or drink that day, because it's very important to your anesthetic. So making sure that they have a proper IV, because that's how we're going to take them gently off to sleep in the adult world. And just seeing if they have any questions and also getting their consent for anesthesia.
Yeah, absolutely. And can you tell us a little bit about how you got to become a CRNA, kind of what that path looked like and what got you interested in this as a specialty field?
Definitely. I wish that I had something like what you guys are providing when I was in my undergraduate coursework, because I graduated from college in 1994, but I had no idea that the profession of CRNA, nurse anesthesia, was a thing. I thought that my only advanced practice option was to become a nurse practitioner, which I thought that's what I was going to do. And then I learned about nurse anesthesia, which I thought, was definitely the route for me. And it was. So becoming a CRNA was not something that I had thought that I was going to be from growing up. I really thought that I was going to be a physical therapist. So moving from thinking that I was going to go into physical therapy to go into nursing, to then think nurse practitioner, to then find CRNA, it was not a straight path to get to this route, but ultimately this is the best career that I could have possibly ever chosen.
Yeah, and can you speak to the educational path to get to CRNA?
Yes, and that has changed recently. All nurse anesthesia programs are credentialed, accredited by the Council on Accreditation for Nurse Anesthesia Programs. The COA, for short, has mandated that the admitting class of 2022, by the admitting class of 2022, all nurse anesthesia programs must have a final product that is a doctoral education. They have to have their Doctor of Nursing practice. Prior to that, you would graduate with your Master's of Nursing. So now that that new mandate is in place, many of the programs have already gone to it. But so you can start out with an associate's degree in nursing, work your way up to a bachelor's. From there, then you can go from a bachelor's to a doctoral degree. Many of the programs are BSN to DNP now. So when I went through, I did start with a bachelor's, achieved my master's, and then I went on to get my doctoral degree.
Yeah, I think that's great. I think you don't always think, you hear doctorate degree and you kind of think medical doctors only, like MD, traditional med school route. And we actually had quite a few questions from students about, could you explain the difference between the work that you do as a CRNA and somebody who maybe went to medical school to be an anesthesiologist?
Absolutely. One of the main differences between an anesthesiologist who is a physician anesthesiologist and a CRNA is that the CRNAs, we do go to nursing school, the physicians go to medical school, but CRNAs can work in collaboration with an anesthesiologist and a physician anesthesiologist. Or a CRNA can work in independent practice. There's 17 states out in the United States that allow CRNAs to work independently. And while Ohio is not one of them, we have had recent legislature that has increased our ability to have a broader scope of practice. Sorry.
I think we all are dealing with dogs in the background right now.
Yes, that's for sure. The CRNA can practice independently, and CRNAs can bill for their services. So the majority of the time, we are billing for our services, which provide our salary. So we aren't a heavy load to a healthcare system, because what you can bill for my services really is what you're providing my salary from. So a physician anesthesiologist goes to medical school. A CRNA goes to nursing school. When a nurse goes on to be a CRNA, you usually have to have a bachelor's degree. You have to have a bachelor's degree in nursing, and then a minimum of 1 to 2 years, depending on which school you're applying to, which nurse anesthesia program. You have to have a minimum of 1 to 2 years as an ICU nurse before you can go on to apply to a nurse anesthesia program. And then all nurse anesthesia programs are now doctoral level, going to be at least for the admitting class of 2022. You have to have a doctoral degree. And so now school is not 2.5 years, it's 3 years full time.
Yeah, that's good to know. And so, someone on Facebook wants to know if the CRNA field requires a lot of math as far as coursework.
Yes, it does. It's a lot of, I'm going to say medical math and physics. So it's not a whole lot more math than what you're going to get in nursing school. But yes, the calculations are there. Drips are there. You definitely are going to need to have math for sure.
That's always a big question as students are kind of selecting majors is what is that math requirement like? So could you talk to us about what kinds of skills or qualities, strengths that someone might need to be successful in this career, or even to be successful in school to become a CRNA? What are some of those qualities?
So I think that's an excellent question, because a lot of people think it's just book smarts. I think most of the time is what people think, oh, I just need to be smart and I can do this. I think that to be a successful nurse anesthetist or a nurse, it takes somebody who has a lot of emotional intelligence. And what I mean by that is somebody who can read the room, read the situation. Obviously if you are not very empathetic or don't have a good ability to have communication during joyful and stressful times, emotional times, I think that's going to be very difficult. The people who are very in tuned with their patients and understand that it's not just a diagnosis there in the bed. That's an actual patient that has a family member, a loved one, somebody who cares about them very much. And, you know, that's a quality that you don't lose when you become a CRNA. You have less bedside care. And what I mean by that is where you have all of the family in the room with you. You really only get to see the extra family, and that's a limited amount of family that's allowed in the pre-op area.
Mhm.
So having emotional intelligence, being able to communicate effectively with your coworkers, with physicians, with nurse practitioners, with the family members, it's very important. You definitely need to have compassion and patience. Not everything is going to go. And we always, in our program, we try to teach our students to not be technicians. You know, don't just do something because that's what the process says. Understand why the process is the way it is. You don't just, you know, A leads to B, which leads to C. Well, understand why A leads to B, and then
Mhm.
C. Don't just be a repetitive robot.
Yeah, that makes sense. Kind of that like critical thinking, definitely. And yeah, I imagine it's, you know, if you're dealing with patients and families, that's a scary time for them, you know, to be going into surgery and things like that. So, absolutely, those people skills are going to be so important. So somebody in the Facebook asked, and I think we touched on this a little bit. They asked, for the CRNA undergrad classes, somebody asked if they were the same as pre-med undergrad courses. And we talked about does every student that's applying to school have to have the BSN? Is that kind of the direct path?
That's correct. In order to go to CRNA school, you do have to have a BSN. That is a requirement, a prereq. But the courses for to are they asking, are the courses for a CRNA?
They asked, are they the same as pre-med undergrad courses? So probably not the same, but probably similar, like overlap.
You're going to have some, but you're not going to have to take all of the chemistries and the biologies that they would in med school. So you're going to take the physical assessment, pharmacology, physiology, anatomy. You're going to take those courses, and you may or may not go down a different path with extra chemistries, but you don't know, they are not the same. They're similar, but they are not the same.
I think that's helpful, definitely, especially if we have students who are kind of maybe considering like medical school, but also thinking about alternative routes for sure. That's very helpful. And then our next question actually, oh, I'm sorry. Did you have more to add to that?
We have had plenty of students who have started going down the route of pre-med and then decided that nursing school was just a route that they would prefer to take. So we have had people come to CRNA school that have started in pre-med.
Yeah, that's a great point. And do you think there are advantages there to taking that path as opposed to going to medical school?
I don't know if it's necessarily an advantage, because sometimes it's an advantage because you're getting those extra science courses for sure. You know, it's more knowledge, but it's like sort of like the path that I took. It wasn't a direct path there. So it might take you just a little bit of extra time that you have to go complete some more courses because you started in pre-med and then switched to nursing. So it's just,
Yeah, and kind of the path, you know, like you mentioned, you have to have, you know, 1 to 2 years of experience as an ICU nurse, and oftentimes that's not a recent graduate's first job is ICU. Typically they may start somewhere else. Could you kind of talk about, you know, why that experience is necessary, and you know, how to get there if you if that's what you want to do?
yes. And definitely you have to have ICU experience. That is true for any nurse anesthesia program. And it's that way because your role in the operating room is a very independent role. You need that ICU, that high acuity, the experience of the ICU, because that's the highest acuity that you're going to be able to achieve as a nurse. That's the type of experience that you're going to be having in the operating room. When you're a CRNA, you don't have the anesthesiologist standing right next to you. At Grant in particular, but this isn't true in all facilities across the country, you have the anesthesiologist there for induction, but you're placing the tube, you're doing, you're pushing your meds most of the time. If they choose to push your meds, then that's their choice, of course. But you're the one that's doing the induction. They're present for induction and they're present at the end when the tube comes back out. But the CRNA is the one that's doing that role. They're pushing those medications. So I think that having the ICU experience really teaches you how to have the most high acuity patients, care for that type of patients, learn about the different the different medications and the pharmacology that goes along with taking care of a patient in the operating room.
Yeah, that makes sense. And I think, sometimes students don't think about that as, a lot of them will work as a registered nurse, maybe in other areas before they get into the ICU. And, get that experience that way, but it all kind of preps you for what you need for CRNA school. So I think that's really important. I want to kind of jump in to talk about kind of like your experience on the job. One of the biggest questions we got was, what is your favorite part of being a CRNA?
Gosh, it's honestly very cliche, but there are so many. I mean, because sometimes my favorite part is going into the pre-op room, having a patient that is truly very frightened to have anesthesia, and being able to talk to them and help them understand that it is very safe, that they're not going to be alone ever in the operating room. Just kind of prep them for what to expect, the bright lights, sometimes the noise that is present when you're first going into the operating room. Offering them some anti-anxiety medication once it's appropriate, that type of thing. That gratitude that you feel from being able to take that patient from a high anxiety level to okay, I trust you and I trust this process and I feel comfortable with you. That's very gratifying to being in the operating room. And if something starts to change and you are doing your job very well and you catch it and you alert the surgeon or whoever else needs to know, many times we're capable of fixing anything that we see right then and there. But if it involves something outside of what we can do on our own, getting that help, the trauma patients that roll in, being able to see them to the ICU when they had a very grim prognosis to begin with, to even just waking up a patient and having them come out of anesthesia and immediately thank you for your anesthetic. That's always, it just is a great feeling because you're still in this groggy state and you're already grateful for your experience, so there's just a range of things that feel good.
Yeah, I imagine that when they wake up, it's just like such a relief, right? If they were very terrified going in, that they're just like, oh, she was right. Everything's okay.
They're just like, are we done already? And it's been a 2-hour surgery. It's like, yep, you're all done.
That's great. And that speaks a lot to the people skills that you mentioned that are so important. And yeah, you may not think about that as much because like you said, you're not spending as much direct time with the patients that, a bedside RN might, spend with them. And so absolutely, that's really, really important.
Mm-hmm.
Let's see here. Could you talk about, as you are, working in the clinical setting, about how many patients or surgeries do you assist with in any given day?
So I try to take the word assist out just because we are the ones doing the anesthesia. And a lot of times people do think that our job is to kind of assist the anesthesiologist. And so,
Mhm.
that isn't our role. We are definitely the ones doing the anesthesia from start to finish. So it really depends on your room. Some days you can get assigned to a cataract room and you do 8 to 10 cataracts. The other day you might be in a large bowel resection case or a large spine case, and you can do one surgery in your 8, 10, 12-hour shift. But a lot of times you're in orthopedics that have a fairly rapid turnover, some plastic cases, meaning like plastic surgery. So they might be doing wound INDs, they might be doing wiring the jaw shut, fixing nasal fractures. Those cases can go pretty quickly. So it really just depends on what your assignment is for the operating room that you go to that day. It changes every day. It's not like my room is OR3, and that's the room that I go to every single day that I go to work. That's not the case at all. When I go to work, I might be over in OR1, then I might be in OR19. There are some days that I could be in 3 different rooms as the surgeries, we call it come down or finish in one room, and then you might need to move to another room. So it could be a very full day.
Yeah, so it sounds like it all depends on, just the types of surgeries that you all are attending to. So, yeah, absolutely. I think that is really helpful to know that your days could look very different from each other. So, yeah. And then somebody wanted to know, and I mentioned this question to you. What are some of the extreme things that you've had to do?
Um, they definitely can be extreme. I I had a patient one time that he was a wrestler, and when he woke up, boy, it was like somebody turned a light on for him. He woke up and it was like almost immediately on all fours on the OR cart that we take him to the recovery room. And I was like, holy cow, how are we going to manage this now? So you have to get very good with your people skills and try to rationalize with somebody who's not capable of rationalizing. I've I thought one day a patient was being very kind to me and just kind of wanted to say something nice to me after I took him to the recovery room. And when I got close enough, because he asked me to come and, can I tell you something? And I was like, sure. And he put me in a headlock. So that was interesting. But for the most part, I don't think that anything is too crazy. It's just part of our world. You might have an emergency intubation that you need to assist with, and that your day can be extremely unpredictable. You might have a room full of orthopedic cases, but a trauma comes up immediately that needs to go straight from the ED to the OR, and you're the one that's available to take care of it. So then your brain has to shift and you go into trauma mode. There's just a whole lot of fun things that can happen, like in a positive way. The teamwork in the operating room is fantastic. I mean, you have you as the CRNA, you've got the anesthesiologist, you've got the scrub techs, you've got the circulating nurse, you've got x-ray, you've got sometimes people that are doing the lasers, if there's a case like an eye case that might need lasers. So it's a very eclectic world, and it's nothing like bedside nursing that most people get to experience in their lifetime.
Yeah, absolutely. Um, what would you say are some of the biggest challenges that you face in your job?
Biggest challenges can be the emotional toll that it takes. We don't do pediatrics in the world that I live in, but you know, anytime you have the unexpected trauma, that an accident happens and somebody's life really gets altered completely, whether it's you know a very, very bad outcome, or if it's just something that really is life altering for them, how difficult their road is going to be. But the challenges can also be that, something as much as just your schedule changing. You think you're going to do one thing, and then maybe that surgeon gets called to do some other emergency cases, so now you're in a different room, and just kind of toggling back and forth between some ORs. I think just really the biggest thing is the emotional side of it, but we have great teams, so everybody gets a chance to debrief.
Yeah, absolutely. And I think that's something that, our students, they kind of learn about as they're going through nursing school. You'll kind of see some of those challenges and be taking care of those patients. And all of that, I guess, provides a strong foundation for you to, move in and, kind of understand and empathize with some of those really tough cases for sure. And speaking of the schedule, someone asked, are the working hours flexible, kind of like if you work as an RN, a lot of times it's very flexible. What is like the actual schedule like?
It really, we consider it, we try to engage our students with the thought that you are no longer doing shift work. And it really depends on what facility you're working at, because I could go work at a plastic surgeon's office and work 9 to 1. I could probably go to an academic center and I know that I'm working a 10-hour shift, but there's nobody there to come relieve me right away. That doesn't necessarily have to be an academic center, but if the staffing isn't up, you could be there until your case is finished. You could also work in independent practice where you don't know. You go home when the cases are done. So one of the benefits of working at a facility that has multiple CRNAs is that you can sort of do the shift work. I'm an 8-hour CRNA. I've got a 10-hour CRNA there also, and then there's a 12-hour, and then sometimes we have a 24-hour coverage person too. So the ability for you to get out of the OR on time is a real possibility. And that is something that is better for a work-life balance. So it really, the beauty of being a CRNA is that there are so many different possibilities, because I could go work at the plastic surgeon's office, or I could go work at an academic center, or I can work at a level 1 trauma center. I can do kind of whatever I want. You are not going to have a first, second, and third shift, or I'm sorry, more like nursing is like a 7A to 7P and a 7P to 7A. You're not going to have that type of shift work. You're still going to have weekends for the most part, but you could also work in a facility where you do no nights, no weekends, no holidays, no call. There's so many endless possibilities. I know some people who work 13-hour shifts. I know some people that do 24 and an 8. So they're still considered full-time, but they're working 2 days a week. So there really is not a set shift. There are so many different options.
Yeah, that's helpful to know. And it sounds like it really depends on the employer and on, the setting and the needs of, exactly where you're working. So it sounds like you'll have flexibility as long as you're flexible about what kind of facilities you want to work at.
You're absolutely right.
That's great. So we can kind of shift. I know you had mentioned kind of working in an academic center, and that's a whole different part of your job as as an educator, right? So can you talk a little bit about what advice do you have for someone who wants to eventually become a CRNA, especially for our students right now who are probably working on their associate degree, and so they kind of have a long way to go. So they're maybe thinking about things ahead of time.
Yeah, I absolutely. If you are working toward your associate's degree, I applaud you. I mean, you're taking the first step to becoming a CRNA, because you have to get there. You've got to get in there. You've got to see if clinicals are really what you like. The best way to see if you like something is to go look at it for yourself. So obviously, if you're in the nursing program already, then you're identifying what type of nursing you like. You should be able to get to see in nursing school the different areas. I mean, from psych to GYN to med surge to ICU. I think you even get to take a trip to the OR. I remember I did. And I remember focusing more on the nurse anesthetist and what they were doing than what the surgery was about. So that should have been my first hint. But try to explore as many areas of nursing that you can. I think one of the best things about nursing is that you're not stuck in one area. And even as a CRNA, if you heard what I said, you do orthopedics, or you do GYN, or you're going to do plastics, or you're going to do eyes, you know, and there's a lot of different variety. You're not going to get bored. So starting with your associates, then you're going to need to go on to your bachelor's if you want to become a CRNA. You've got to achieve that bachelor's degree. From there, then get into the ICU when you can. I know at Ohio Health Facilities, they have a fellowship program. And so that's a very strong way to be able to get into the ICU, because our nurse anesthesia program is, it's a dual authority program. So I've got Otterbein University as our degree granting entity, and I've got Ohio Health Grant as our main clinical site, and through who we do most things through. So I know that people who come through our application process, or our interview process, when we see that they've done the ICU fellowship through Ohio Health, we know what kind of quality ICU experience they've achieved. So getting into the ICU as soon as possible is excellent. It's not an easy task to accomplish, but I do think it's easier than it was. I think we have a bit of a nursing shortage going on. So getting into that fellowship at whichever facility you can is definitely the way I would go, and plan to be there for the minimum of 2 years. You have to be able to achieve your CCRN in order to apply to CRNA school also. And that takes a certain amount of hours, probably about 1 year working in the ICU to be able to even be eligible for the CCRN. So yeah, I mean, if you are starting with your associates, you do have a little bit longer of a ladder to climb, but it's completely doable. And we've had many people graduate from our program who have started with their ADN and worked their way up.
Yeah, absolutely. And I know just personally, I see a lot of students in career services who are prepping their resumes and interview skills for those fellowships, and our students have been really successful in those. So that's a really great kind of plan. And I know that that's something that is, really of interest for our students, but it's nice for them to know that, the ICU setting is an option for that. I think they have several different fellowships available, and that's one that they could really pursue. And then for those who may not know, can you explain what the CCRN is? We have a lot of jargon and a lot of acronyms.
Test. It's a formalized test that you would need to take and pass in order to declare that you have your CCRN certificate. So it's a critical care registered nurse test that ICU nurses can take in order to achieve that certificate. And it's just a little extra notch in their belt to say, I've done the extra work, I've done the extra preparation, and I'm rewarded with the certificate that I can use on my resume, and also that you need in order to apply to any CRNA school.
Yeah, that's great. So it just kind of formalizes that experience that you've had in the ICU setting. Absolutely. We have lots of questions from students about, they want to know, are there shadowing opportunities for someone who wants to become a CRNA? How could they do that? Do they have to be a nursing student first? What are your thoughts on that?
They really have cracked down on it on the days of COVID. So I don't know that unless you, at least at Ohio Health, you cannot shadow unless you are a nurse within Ohio Health. Their rule is that if you work in a different facility, they prefer you to shadow in the facility that you work in. And you would just need to contact the anesthesia department and go through the channels through them to see how you can shadow. I know that we have had plenty of people come through and, spend a day with a CRNA or an anesthesiologist to see if the operating room is right for them. Because like I said, it is not the same as bedside nursing. They're not similar at all. So other than the fact that you're taking care of a patient, that's where the similarities end. So there are some people who might get into the operating room and just be uncomfortable with it for one reason or another. I mean, clearly operations are taking place. So if that's not something that they'd be comfortable with, then, perhaps there's another type of nursing that they would be more comfortable with.
Yes, absolutely. I think I've even helped plenty of nursing students who decided they couldn't see blood at all. So maybe nursing wasn't the path for them. And you find out by seeing it and doing it. And yeah, so I think the idea that our students are trying to shadow and get exposure to these things is a good thought for them right now.
I highly recommend it. And we even, in our interview process, we do ask if you've been able to shadow before. I mean, even as an ICU nurse, we want to know, have you looked into it? Do you understand, the way that the operating room looks, not runs? We don't expect that, but have you at least experienced it to know that it's right for you? And the vast majority of the time, the ICU nurses who are applying to our program, they have shadowed. But it is easier once you're an ICU nurse to be able to achieve that shadowing experience versus a nursing student, even a student who is thinking about applying to nursing school. Trying to get into a shadowing experience is certainly a little bit more difficult. I wish it wasn't, but for HIPAA rules, there really are a lot of restrictions that are placed on it.
Yeah, and one thing that I think students may be able to do is to have conversations like these. We can share this video with them and they can learn that way, but maybe something more like an informational interview might be beneficial to them. And I know you've mentioned these here and there throughout our conversation here, but could you mention some other sites that CRNAs work other than just, a traditional like emergency room or something like that? Where could our students maybe reach out to or connect with someone who's working in the field?
Definitely. Almost every major hospital around Columbus and the outlying areas, there's going to be CRNAs employed there. You are only going to find CRNAs in the operating rooms at hospitals, but there's sometimes there are the freestanding outpatient surgery centers that there's CRNAs there. Sometimes, like I said, a plastic surgeon's office, sometimes a dentist office that does like wisdom teeth extraction or any other dental procedures that patients require anesthesia for. Some podiatry offices, but that's going to be more rare. They would bring those more toward the operating rooms. But really the freestanding outpatient surgery centers and the hospitals are going to be your best bets.
Yeah, absolutely. That's helpful. And we have only a few minutes left. So I just want to encourage all of our Facebook students, if you have any last minute questions that you want to get in, go ahead and type those in the chat now so Taylor can relay those to us. But one question that a lot of students have is, how can they make sure that they're a competitive candidate if they have their RN, maybe they've gotten their BSN, that's pretty much all of our students' plan anyway. And how can they make sure they're a competitive candidate for CRNA school?
Excellent question. And I would strongly encourage them to have wonderful GPAs, but they're science GPAs. A lot of times there's students, they start in a program or in a different major, and they don't succeed very well at it, and so they decide that they're going to change their major. Well, you might have to retake some courses in order to get your science GPA back up to at least a 3.4, 3.5. I will tell you that the candidates that we interviewed this year, almost all of them, we had 110 applicants for 24 spots. The vast majority of them were like a 3.5 or above. So then you need to figure out, how are you going to separate yourself from that? If the vast majority of us have a 3.5 and above. What's going to make me different? Leadership positions. Once you become an ICU nurse or a nurse, what type of leadership positions are you going to take? Have you been a charge nurse? Are you a member of a committee? Are there any task force that you could join? Something that gives you that leadership experience, I think makes you a better candidate, just because you've had that ability to have difficult conversations, you've handled difficult feedback. I would just say that don't just be okay to just be a staff nurse. Go that extra mile to get experience in leadership.
Absolutely. And that's a conversation we have with our students all the time, even as they're graduating with their associate's degree in nursing. There are 100 others graduating at that exact same time. So as you're preparing for whatever is next, that's something that we ask them. So just to keep that in mind, what sets you apart in a good way? How are you going kind of above and beyond? Yeah, that's really, really helpful. And then I think we have our last question here. Are there particular, let's see, I think we kind of already touched on some of our skills, but is there anything that really makes someone really successful as a CRNA? Are there any like personal qualities that they might need to have in addition or aside from those people skills? Anything else that you think would help make someone successful?
Being coachable. There are a lot of people who think that, I'm at the top of my game. I am the best ICU nurse, and they could very well be the best ICU nurse in their unit. I am charge nurse. I'm on this committee. I'm on that committee. I don't have anything else to learn. And so if you come in with that attitude that you can't teach me anything because I already know how to do it, then that's not somebody that makes for a good teammate, that really is an asset to the culture. So I think being coachable and having the desire to improve. The students who think that, well, it's 3 o'clock, it's time for me to go, when there's this great case coming up. If you don't think that you can benefit from seeing that next case, maybe you're not the most coachable, maybe you're not the best one around anymore. You might've been the best in the ICU, but just always wanting to learn, understanding the process, wanting to get better with your physiology, with your pharmacology, because it all ties together. Being a CRNA is a very independent career. You're the one that's watching the patient. You're the one who's monitoring the vital signs. You're the one that's making the adjustments to the medications, to the inhalation agents, to the drip rates, to your IVs, to, getting blood if the patient needs it. You're the one doing that now. So we need you to be the focus. And so getting into anesthesia school and being that person that's like, yes, I want to take it all in. Being coachable is the best thing.
That is perfect advice. So we are out of time, but I just wanted to say thank you so much to Casey for being willing to share your expertise and encouragement for our students. I know a lot of them are thinking about these kind of advanced practice